Welcome to Therapy Thursdays on Louisiana Living. We are glad that you joined us today. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
We are with Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now even El Dorado, Arkansas. I am a doctor of physical therapy, and what we do here on Physical Therapy Thursdays is we're talking about impairments or diseases, conditions that affect your quality of life, and we share with you how physical therapy can help you overcome those impairments. And then specifically, we always like to leave you with a takeaway of things that you can do immediately to help resolve your impairments. And so I want to just remind you guys that you can always review previous segments on myarchlimist.com. And under the living section, under the community section, look for Louisiana Living, and all of our previous segments are there. And then also you could look on physical/ruston.com and find us there, or even our YouTube page. Our videos are there for you to review also. So make sure you're tuning in each Thursday on Louisiana Living.
So today we're going to talk about knee pain, and it affects a lot of people. And I have a family member that she has severe knee pain, and over the years it's affected her quality of life severely. Climbing stairs, she has a real problem with. You know, you hear, like, sometimes when you climb the stairs and you hear that creaking and popping, and it just scares her, and she doesn't want to do any activities. And that's not what we want for our viewers or our family or our friends or even ourselves. We want you to enjoy life to its fullest. So that's why Dr. Jerry is going to share some things with us about knee pain, specifically arthritic knee pain today.
Yeah, did you actually know that there are 600,000 total knee replacements performed just here in the U.S. And the primary cause of knee replacements is primary osteoarthritis of the knee.
Is that every year?
Every year,
Wow.
600,000. Now, just a quick cap on what osteoarthritis is. Osteoarthritis is the wear and tear disease of the joints. So as we age, our joints start to wear out. God did not create us to stay here forever, so our bodies do wear out. And osteoarthritis is the result of our joints wearing out. So again, physical therapy can be very beneficial in helping manage the pain and regaining your quality of life. Again, remember, here at Physical, our motto is that we're here to help you love your life. So come back in the next segment and we'll talk more about this.
Welcome back to our second segment today on Therapy Thursdays on Louisiana Living. We are Physical Therapy and Balance Centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough, and today we're talking about arthritic knee pain.
Yes, thank you. So we're talking about knee pain, and here in our graphics, you're going to see a normal knee joint, and so we got the femur, which adjoins to the tibia, and it allows motion at the knee. Now, as we age, typically, as we age, our joints are going to degenerate. Everyone will degenerate at different degrees. Some of it depends on genetics, but mostly it depends on what you've done to yourself or what's happened to you throughout your life. If you were in some kind of accident that, caused trauma to the knee, then you will have progressed degeneration. If you were like me, whenever I was a young kid, about 10 years old, we'd go climb up on the roof and jump off the roof like crazy kids would do, and have a lot of extreme impact on our joints. So, I got some beginning arthritis in my knees and in my hips. So, what happens is the joint will degenerate, and depending on the severity, it will definitely impair your ability to move. Now, a common symptom of arthritis is joint stiffness increased in the morning. Like when you first wake up, you're really stiff, and the more you work, moving around taking a hot shower, all that kind of stuff will help loosen you up, and you may feel better. Climbing stairs can be extremely difficult and painful for an arthritic knee. Sometimes just walking. Sometimes if it's so severe, you can hear your knee joints cracking and squeaking. Those are pretty severe and a pretty good sign that you may need some a replacement. Now the technology with replacements today are so advanced. Sometimes it's only a portion of your knee that's degenerated to the point that it needs replacing, and they can do a partial knee replacement. When I started therapy 27 years ago, a knee replacement meant that you were going to be in the hospital for about a month. Today, you're lucky to be in the hospital for a day. And then your rehab will start immediately in an outpatient clinic, in which we immediately begin on controlling swelling and active range of motion, strengthening, and get you back to functional movement. So again, physical therapy is extremely helpful in managing pain with arthritis, and especially after total knee replacements. So in the next segment, we're going to show you some exercises we do and exercises you can do at home to help. So come back and we'll talk about that next. Hey, welcome back. I'm Dr. Jerry Yarbrough, physical therapist here at Physical Therapy and Balance Centers of Ruston, Jonesboro, Louisiana, and now El Dorado, Arkansas. And what we're talking about today is osteoarthritis of the knee and total knee replacements, and how physical therapy can help you. Now, just to remind you, osteoarthritis of the knee is very common, and it's just a degeneration of the knee joint. Osteoarthritis is the wear and tear disease of the joints, no matter what joint we're talking about, but specifically the knee today. So in therapy, we're not God. We can't change the degeneration that's going on, but what we focus on is strengthening the muscles around those joints to help support the joints, which will help decrease the pain. So in physical therapy, many times that's what we're going to focus on, is maintaining your range of motion, increasing your strength, and working on functional mobility. Now in physical therapy, we have different machines, we call them modalities, that we use to help that process along. One thing here at Fyzical that we have is class 4 laser, and that's an accumulation of light energy. It penetrates down into the cellular level, helping decrease inflammation and pain. It can be very effective. So that's just one of the many modalities that we can use in physical therapy. Now, what I wanted to show you before we leave today are things that you can start doing immediately at home to help decrease your pain and improve your mobility if you have knee arthritis, okay? And as our model today is our CFO, Tara Howington, and we're going to demonstrate a few exercises. The first one is what we call quad sets. So these are your quads here, and you're going to tighten these up, pushing your knee down into the mat. You're going to hold that for about 10 seconds, and you're going to do that for at least 10 times. All right, then you can use a rolled up towel or blanket, something like that, to put up under your knee. And again, you're going to tighten your quads, straightening your knee joint like this, okay? I like to have your foot in kind of a neutral position like that. And you go up and then control it going down. Don't let gravity do the work. That's cheating and it's not helping you. So you're going to straighten your leg out and control it going down, okay? And then another exercise, you're gonna take that out. You're gonna bend the opposite leg to protect your back. You're gonna keep this leg real straight. And this is good not only for your knee, but also your hip. Normally, if your knee is affected, your hip's gonna be affected too. So you wanna tighten your quads, hold it real straight, and you're gonna raise it up just about that high and back down. You're gonna try to do that 10 times and do it like 3 sets, okay? And you can alternate legs. And for the last one, you're gonna roll onto your side. You're gonna bend that lower leg, keep the top leg nice and straight. Again, keep your leg nice and straight and raise it up and down. 10 times for 3 sets. And those are 4 good exercises you can start doing today to help manage your pain and improve your functional mobility. Remember, we are Physical Therapy and Balance Centers, and we're here to help you. We'll see you next week.